I really think that now more than ever this has become crucial.
That the speed of change has happened so quickly.
It is exciting and scary both.
Change is here for the health law community, and the pressures are coming in from multiple areas, which means everyone working within health law needs to evolve and become more efficient. AHLA is at the center of navigating this change, leading health law excellence through educating and connecting the health law community.
At the American Health Law Association, the message is clear.
If you want to be involved in healthcare, if you want to be involved in health law, this is the place for you to be.
As CEO, David Cade enjoys keeping the association's more than 13,000 members connected and engaged, though he admits it can be a bit chaotic at times.
But it's managed chaos.
Staying on top of the rapid changes in the health law environment takes focus and leadership.
We are paying attention to the drivers and the disruptors in the health law and the healthcare industry to share and understand what those disruptors and those drivers mean.
The AHLA 2030 Taskforce is doing just that, studying and analyzing the disruptors, identifying trends, and producing a roadmap to help navigate the dynamic decade ahead.
The white paper will give members and others in the industry a view as to what to expect over the 10 years, and I think what we've put in there is fairly likely to happen.
The white paper breaks down and directly addresses the issues: increased consolidation and competition, disruptive technology, shifting regulations, diversity, access to care, the growth of in-house counsel, the financial pressures on providers, just to name a few. But with change comes opportunity.
And that's really the disruption, is who's going to be the new health law professional that comes in and services different segments of the market that currently aren't really serviced by the traditional health law professional.
We've had disruption in the payer community, who gets paid, how we pay for health care, who's covered, how is it covered.
Many answers and solutions are found by capitalizing on new technologies.
So whether that's the use of artificial intelligence to make our job more efficient, whether it's the use of technology to connect with our clients, or whether it's the impact of technology on our clients and having to navigate them through the law.
Big data is a huge disruptive thing.
Collecting and learning how to safely use data is happening in real time. Clinical trials to innovate drugs is just one example.
And what they're trying to do now is leverage all the information we're already collecting to run clinical trials based on that big data. And that cuts down time to market for medicines. It cuts down risk to patients having to go through clinical trials.
Faster, cheaper, better also means evolving federal and state laws and policies.
We are getting smarter at how to do it, I think, from an oversight and enforcement perspective, because we have new tools and data.
Adopting new technologies, always with the goal of improving access.
Many recognize that it is a must. It is a necessity. It is crucial.
Training a diverse health law field to address disparities in healthcare is a daily topic of discussion.
I want more seasoned lawyers. I want more junior lawyers. I want lawyers who have different sort of backgrounds and perspectives, so that ultimately we can solve problems for clients more effectively.
Promoting diversity and inclusion is a top priority at AHLA.
And so I think the key piece that's needed, if we want to see more diversity and inclusion within the field of health law, is creating a sense of belonging.
Montrece Ransom clearly defines the necessary steps.
And belonging means I can show up as my authentic self, and you will allow me to grow. You will allow me to contribute. You will bring me in. And that's one of the benefits of national organizations, professional membership organizations.
Diversity in education brings about excellence in education, which is what the American Health Law Association is known for.
I find that the AHLA task force and the white paper, it really gives me a lot of insights. It really helps me as an educator and somebody whose mission is to train future health lawyers.
The future workforce changing the health law practice and broadening the health law profession.
One of the things that I think makes this association rich is it's not just lawyers talking to lawyers. It's the regulated talking to the regulators. It's government talking to private sector. it's thought leaders engaged in the practice, and it's lawyers and those who are also engaged in the health profession.
Big ideas backed with a clear message and vision.
The ultimate goal is better health outcomes for our community.
Excellence in healthcare requires excellence in health law. Only through educating and connecting the health law community can professionals successfully navigate complex regulatory frameworks, drive business efficiencies, and ultimately help to improve patient outcomes.